We respectfully acknowledge that the Windsor Regional Hospital occupies the traditional, ancestral, and contemporary lands of the Niswi, Iskwandonwa, Anishinaabe, the Three Fires Confederacy, Ojibwe, Odawa, Potawatomi. We acknowledge the land and the surrounding waters for sustaining us, and we are committed to protecting and restoring these lands and waters from environmental degradation. Good afternoon, all. I'll call the meeting to order, and Happy New Year. Does anyone have a declaration of conflict of interest at this time? Seeing none. If not, if something arises during the meeting, please declare it. First item on the agenda is the approval of the previous minutes of December 4th, 2025. May I have a mover? Genevieve. Seconded by Paul. Any comments or questions on the minutes? All in favor? Motion carries. Next item on the agenda is the President and CEO of the CNE and the Chief of Staff. Karen, I'll turn it over to you.
Thank you, Mr. Chair, and good evening, everyone. I'll just wait for Matt to bring up my presentation. Happy New Year, everybody, as well. Thank you, Matt. Just go to the first slide, please. So as everybody probably saw in all of our announcements last week, we were pleased to announce our new incoming president and CEO, Kristen Kennedy. So Kristen will be joining Windsor Regional Hospital on March the 23rd, and we look forward to welcoming her back to the organization as she worked here previously as our Director of Critical Care and Cardiology, and prior to that, our manager for our neurosciences program. So we have a thorough transition plan in place, and Kristen will be at the hospital sites meeting with frontline employees and professional staff soon after her start date. So we look forward to that. Next slide, please. So just a reminder that both Windsor Regional Hospital and Erie Shores Healthcare and Windsor Essex have been experiencing higher than usual volumes in our emergency departments. This really spiked up just before in alignment with Christmas, which is kind of normal that we see as the influenza virus starts spreading through the community. So we did want to provide a reminder of alternatives to the emergency department if your issues are non-emergent in nature. So those are listed there. They're also on our website. But we do want to remind people that if you or a loved one are experiencing severe symptoms, such as chest pain, trouble breathing, signs of a stroke, or a serious injury, please do call 911 and don't be worried about coming to the emergency department, because we do prioritize, obviously, life-threatening illness. But for less severe illnesses, there is a prolonged wait time. So we do thank our community for their patience during this challenging time with our surge season. And also for treating our staff with kindness as we provide care for the community under these stressful times. Next slide, please. Just a reminder also, it's not too late to still get your vaccinations for influenza and COVID. So there is a link there. You can go to the WeChew website and as well go to publichealthontario.ca. We'll give you some information on how to prevent the spread of respiratory illnesses this season. So if you're sick, stay home, wear a mask if you're going out, and of course, cover your cough and wash your hands frequently. And hopefully we'll get through the next few weeks. We are expecting, of course, that the influenza numbers will continue on through the next couple of months. And I'll now turn it over to Nicole, who'll give you a little bit more data on what's going on provincially. Over to you, Nicole.
Thank you, Karen. We can move to the next slide. So on this slide, we have updated numbers as of the last reporting period, which was December 24th in hospital. We have our new numbers for today, and it is slightly higher for total flu RSV in the hospital, about an additional 6 cases above what's reported here, and obviously seeing a spike with influenza activity very high in the province, exceeding 25%, and COVID activity continues to be low and has decreased to the previous compared to the previous week. And RSV activity is also low and trending downward week over week. And that also is maintaining the same, even though RSV had a little bump up over the holidays. Next slide. So in alignment with our strategic direction number 5, enhancing collaboration and strengthening partnerships to build a better healthcare network, we had a corporate-wide community giving campaign with participation across the entire organization, which was very strong and reflected a sustained culture of social responsibility and community partnership. The largest contribution came from 4 West at the Met campus, whose collective efforts significantly supported the overall success of the initiative. Health records also demonstrated a notable engagement through departmental collection benefiting Drouillard Place, a charitable organization providing essential programs and services to residents in the Drouillard and Grandview communities. In addition, staff donated dozens of children's winter coats to the Community Support Center in Belleville, supporting families experiencing financial hardship and contributing to improved well-being for children in our region. These contributions illustrate the organization's continued commitment to the community, to community engagement, and reinforce the values of compassion and service that guide the work that we do. The next slide, please. So in alignment with strategic direction number 1, strengthen the processes that drive a proactive, inclusive culture of patient safety and quality care. Cross-functional working group across the Safe Workplace Committee, Patient Relations, Public Affair, and Equity Diversity came up with a new poster. The purpose of this group was to develop a welcoming, patient-facing communication that reinforces our organizational commitment to a safe and respectful environment for both staff and patients. The resulting poster is entitled "Everyone Deserves Safety" and is designed to be clear, accessible, and supportive while communicating the hospital's zero-tolerance stance on violence. This campaign complements the hospital's patient rights and responsibilities, which affirm that patients have the right to safe, high-quality care delivered with dignity and respect, and the responsibility to engage in behaviors that support a safe environment for staff, other patients, and visitors. The poster directs individuals to the full policy, which is listed here, ensuring transparency and accessibility. And the campaign supports our broader organizational focus on staff safety, patient experience, and respectful engagement across all care settings. And I think that's the last slide. Thank you. That's the end of my report, Mr. Chair.
Forgetting the microphone again. Any questions of Karen or Nicole? Nadine?
Yes, thank you, Chair, and thank you for the presentation. I did want to ask about the influenza, the increase in the influenza. Is there any reason that you think that is? Is it primarily because of, the strain of the influenza, or is it around the practices, hand washing, etc.? Is there anything that you could share, any insights there?
Oh, sorry, go ahead, Karen.
No, I was just going to say, so the numbers that we're seeing are really representative of what's going on in the community. And maybe I'll ask Dr. Saad to chime in as well, just to talk about the strain that we're seeing. It is primarily influenza A at this point. And we know we don't have 100% vaccination, of course, in the community. So there's definitely opportunities for spread. And I'll maybe turn it over to Dr. Saad if you want to add something with regards to that.
Yeah, no, you're right, Karen. It's definitely a combination of factors. The strain in particular mutated or developed after the vaccine was initially created. So the flu vaccine comes out 3 or 4 months before it starts to circulate worldwide. This particular subclass of H3N2 does not seem to be a perfect match for the vaccine, which is why we're seeing higher rates of influenza. But even being vaccinated with a vaccine that's not a perfect match does still offer protection against severe illness or hospitalization. But we're also seeing the peak of influenza season, travel with the holidays, people being out of school and getting together, of course, during the holidays. So there's many factors contributing to this particularly bad influenza season. But one of them is the vaccine mismatch and the lack and the poor vaccination rates, as well as obviously the time of year.
Thank you.
Thank you, Karen and Dr. Saad. Any other questions or comments? Seeing none, the next item on the agenda is the financial presentation by Chris.
Thank you, Mr. Chair. Do we have those slides or do we? Perfect. Thank you very much, Matt. So we'll go on to that next slide there, please. We look here that the net deficit after building amortization in this year to date, November 25 slide shows us at 19,675,000. It's a little bit better. It's 1.153 better than the budget. So that's the good news, but obviously we don't want the budget on that bottom line to be negative either. So we've been good at budgeting it. It's just not a great budget story, I guess, at that stage. The hospital margin is negative 13,918, which is again still a little smidge over $1 million better than budget. So we go on to slide 3 there. The chart here will indicate expense variances and their offsetting revenues that we've got here. So salaries and wages remain in surplus, about almost $750,000 there. It's unchanged comparable to the October variance as well. Benefits is a surplus of almost nearly $2 million there. Year to date, it's mostly as a result of the WSIB surplus distribution of $1.77 million. Medical staff fees are 3.6 million deficit. 3.7 is an offsetting funding from the emergency and NICU alternative funding is in there as well, and patient services revenue for diagnostic services. Physicians received retroactive payments for 24-25 at 9.95%, for which funding was received. So that explains some of that difference there. Medical and surgical supplies had a surplus of 540,000. That's an unchanged percentage-wise when compared to October year to date. Surpluses in operative program is offset by deficit in diagnostics, primarily in interventional radiology. Drugs has a 1.54 surplus in there as well. The variance is unchanged. Other supplies again has that bucket that we have there, 1.7 million deficit. There's no offsetting revenue. Things that make up of concern in that area are contrast media, physician recruitment costs, building and equipment maintenance, patient transportation, and legal and consulting fees make up some of that. As we've tracked in the past, we go to the next slide. We look at our sick and overtime hours as a percentage of total hours worked. Here we can see for the month of November in the unionized areas, sick percentage at both campuses is above the target of 4.8, with Met at 6.4 and OLED at 6.5. Both have improved those since last month. And overtime percentage at Met campus is below the target of 3.9, and OLED is 5.6 versus the target of 4. So both have improved as well there since last month as well. And the last slide here we have is the sick and overtime benchmarks for the non-unionized staff in the month of November. Again, sick percentage is 1.3, again, still below the target of 2.2. And we have an overtime percentage of 0, which is exactly as we expect for the non-union group. So with that, I will move the report and the results from the November financial statements, Mr. Chair.
May I have a seconder, please? Seconder David. Any questions or comments for Chris? Seeing none, all in favor? Motion carries. Next item on the agenda. Oh, I actually probably jumped past the Schulich report. Dr. Jacobs is in the emergency room this evening, and there will be no Schulich report. For your information, the media report is attached to the documents that you received. You can see that we got a lot of press coverage on Kristen Kennedy's hiring and other matters that went forward. I'd like to thank Steve Irwin for putting together a great summary. Does the board have any questions, comments, or notices of motion at this time? Seeing none. The date of the next regularly scheduled meeting will be via Zoom on Thursday, February the 5th, 2026. If I may have a motion to adjourn, please. Linda, seconder Patty, all in favor? Motion carries. Thank you all for your attendance this evening, and we'll see you shortly.